Okay, so as a part of our Adapt for Life program, the first tenet is movement. So what we're going to talk about today is we're going to give you a few exercises to help you maximize your health, the way that you're feeling, and help you get the best results possible in the chiropractic office. The first thing that we're going to talk about, which is arguably the most important as you get started in care with us, is spinal hygiene. As chiropractors, we value the health of the nervous system, and if we can maximize the health of our spine, that will help us heal faster, more rapidly, and allow us to feel our best in the short term. So I'm going to have Dr. Bailey demonstrate these spinal hygiene exercises so that you can see that in real time and watch these videos as many times as you need to in order to get this cadence in these exercises down. So we're going to start with flexion and extension. So we'll have Dr. Bailey, so this will be of the full spine, Bailey. I'm going to have you bend over, touch your toes, and then extend all the way back. So if you're experiencing a lot of tension and tightness through your thoracic spine, this is going to be really great to help to open your spine and your system up. So you want to go through this 10 to 15 to 20 times. Just doing this a few times is fine, but the more reps that you give for each exercise will allow you to feel better faster. The second one is lateral flexion. So I'm going to have him reach over the top of his body, really stretching out the side body, and then moving to the other side. While he's doing these exercises, he's breathing deeply in his diaphragm. He's feeling the stretch happen. He's getting a big muscle stretch right here through the lat and into the armpit, into the shoulder. Same thing, you'll do this 10 to 15, 20 times. The third one is rotation. So he's going to interlock his hands and rotate his entire torso through his hips. As he's rotating, if he's going to the left, he's going to be engaging this glute on the right side to further twist and corkscrew his body around. And with his hands, he's going to be actively pulling in the direction that he's going so that he can engage his upper body. Same thing, 10 to 15 to 20 times. The more reps, the better it is. Now we're going to switch to the neck. So we're going to go through the same ranges of motion. First one is flexion and extension. With extension, you'll want to take this slowly. If you're lacking in some neck ranges of motion, it can be a little tight. But his goal is that he wants to try to look up straight at the ceiling and then flex all the way down to touch his chin onto his chest bone. 10 to 15, 20 times. Second one, lateral flexion. He's going to touch his ear to his shoulder. But what I want him to focus on is lifting this top ear up to the ceiling to get a little bit more of the base of his skull stretched. Don't overdo it. Take it slow. It's not a race. We're just trying to get better mobility of our spine. The next one is rotation. So he's going to try to keep his shoulders into one position here. We're not rotating the upper body. He's rotating the head through the neck onto the shoulders. If you feel like one of these areas going in one direction or the other is tighter than the other, you want to spend a little bit more time there. It might start where you don't feel like you have very good range of motion, but the more often you do this, the more consistent you are with it, the better your results will be. The next one is big neck roll. So he's going to take his neck and move it all the way around. It's very common, especially in this exercise, that you're going to feel maybe some mild popping, some snapping, some cracking inside there. That's totally normal. Don't overdo it. We're not trying to pop our own neck like you would receive in the office. We're just simply moving it around, reminding the muscles what their job is to move us through space. After he goes through 8 to 10 on one side, he's going to switch directions and go the other way. So now we've gotten the thoracic spine, the lumbar spine, and the neck range of motion. Next one is shoulders. So Dr. Bailey's going to start with his right arm, and he's going to lift it up and around. Big circles. Moving the SC joint, the AC joint, the glenohumeral joint, really stretching the myofascial system, He's gonna do 10 to 12 in each direction, and then he's gonna rotate his arm in the other direction. If you're dealing with any type of shoulder pain or a past injury, you're just gonna really wanna take this slow. We're not trying to force it. Now back to the right arm, we're gonna go back into flexion and extension. We're working our different areas of our body through the same ranges of motion to restore normal physiology. Good, now you can switch sides. Big rotation there, going backward. He's gonna do that for 8 to 10 to 12 reps and then switch directions. Same thing there, and then he's gonna move into flexion and extension. He's still breathing. He's just trying to get a little bit more mobility each time he does this. And finally, we're gonna move to the hips. So hang on to this, Dr. Bailey, so you don't fall down. I want you to stand in this direction. I want you to just do some leg swings, full flexion and extension. So when he brings his leg back into extension this way, he's really gonna try to contract the glute. So this is good for balance because he's single leg balancing here, but then he's just opening up the muscles of the hips. 10 to 12 to 15 in one direction, and then he's gonna switch legs and go swing that one. If you're dealing with any low back pain or any hip tightness, you might notice that you have better range of motion on one hip than you have with the other. Spend a little bit more time there and see if you can balance them out. And what you'll find is that you're able to move more fluidly. You feel better connected to your body. You're feeling more comfortable as you're up and moving around all day. And ultimately, those symptoms will start to go away.